pretty amazing. I'm here because it probably wasn't 4 years ago that I couldn't even speak. I call it dysphagia, in which I could actually think about the words, but I couldn't get them out of my mouth. And if I did, I would stutter, or I'd forget what I was going to say, or I'd have to spend, X number of time. We have 5 kids, so, for me, not being able to help my wife mind them, so, already thankful. I mean, sitting behind Dr. Wahls is like sitting next to, I was telling her, like, Elton John, like, how can this be? So I'm pretty happy, just already, like, done. So if I screw up the lecture, I have a 3-year-old running around, and it's summer, so there's nothing to be done. So my wife says, well, tell them what you tell me all the time. I have holes in my brain. I can't, it's not my fault. And so, but anyways, so Dr. Wahls told me about speaking quite a while ago, and I've been thinking, like, what am I going to talk about? Am I going to talk about nutrition? Am I going to talk about lifting weights, working out? Am I talking about, I'm like, but certain things happened that I decided the best thing to talk about would be to talk about all those things, but talk about hope. And just the other day at church, something came to me, and the expression, an expression that was out of the Gospel of Mark, it said, she had suffered by the hands of many physicians, spent most of her savings without any cure. So she had suffered by the hands of many physicians, wasted most of her savings without a cure. Like, all right, that's just bizarre, because that just hit me like in the face. So my story goes to this. My mother is up there. She was younger there, but she became very sick and went to many doctors and took many medications. And they didn't quite know whether it was multiple sclerosis or schizophrenia or paranoid. Like, all these things happened, and they kept progressively getting worse and worse and worse. And we continued to go to the doctors. She continued to take the medications. Unfortunately, my dad, I gotta, like, control myself. My dad ended up leaving us at 14. So it was just my mom and my brother and I. So she continued to get worse, continued doing the things the doctor said and doing all those types of things. Okay, I'm better now. When I was 17, she took her own life. And so that was a profound moment for me at that age. I was in college, but that Bible verse echoed in my head. And as I dealt with some of Dr. Wahls' followers, I get a lot of PMs, I get a lot of people coming to me at very difficult times. And what I learned from my mother, which is a really strange thing to say, is maybe the greatest gift she ever gave me was doing that, because in the toughest times I went through, and there's been some really tough times, I realized that doing something like that doesn't take away the pain. Doesn't take away the pain. It only transfers the pain. So my mother, God rest her soul, transferred the pain to me and my brother. And it's been nearly 40 years, and it's like yesterday. So when I thought about the lecture, I said, I just have to emphasize this. So when that happened, I was in college studying pre-law, so I ended up dropping out of college and kind of feeling sorry for myself doing all that, and I was kind of homeless because, well, that's a whole different thing, but I started picking up these strange jobs, and I was selling used cars and, just doing things that I just knew was not the right thing. And so I was opening up the phone book one day looking for a customer, and it opened up to the military, the U.S. Army. So I said, well, that's what I need to do. So, I went ahead and I did that. And after a few years, I got out and joined the reserves and started college. I did quite well in college. I graduated with my bachelor's degree, and then after college, I ended up going on to dental school. During the interview at the dental school, they told me, they said, well, Ron, you're used to getting A's and B's in college, but here, be happy with C's. And so that really kind of pissed me off. And so I ended up graduating the top 5 of my class, which was not bad from, working how many jobs and putting myself through school without any parental support. So after that, I went to do my residency, and I did it in New York. I did one of the most prestigious dental residency, that's around, and it was really, really good. So I did that for a year, and what was different about that is it wasn't about dentistry anymore. It was about being a physician of the mouth. And a doctor by the name of John Schuba, he was all about that. He was head of the medical board. So it wasn't the tooth carpenter thing, and maybe we'll talk about that for the advanced tomorrow. But so he opened my eyes to that. So they asked me to stay on for another year as chief reticent, and I continued my surgical training and my medical training. So, I felt good about myself from where I came. So after school, and I had all those accolades, and I I'm probably missing all my slides here, and I'm just talking. Okay. All that education, all those accolades, I joined a very prestigious private practice in Park Avenue in New York City, and we saw movie stars and all that. And so I did that for a couple of years, and I realized it just wasn't for me because I just wanted to be in the medicine. In dental school, my project I worked, kind of ironic, but it was on autoimmune disease with the diabetic mouse. So here I am in private practice, putting fillings and all that stuff. So I really was. So I ended up leaving that, going to the hospital, and teaching again. I taught residents surgeries in the OR. We took children in the OR, with baby bowel decay or, whatever, even some small cancers and things. And so after all that, all of a sudden I would feel strange things. Like maybe my leg would get a little numb, and I ignore it and keep running or whatever, it goes away. And then, one day I looked over my shoulder driving, and I had double vision. And, there were nurses there, and I would tell them that. And I'd say, oh, that's probably nothing. They're like, no, you better get to the doctor. That's a little more than nothing. I ignored it. And then one day, I couldn't get up the stairs. I literally didn't have the strength to get up the stairs. And my wife made me go to the emergency room. Of course, they did all the MRIs and the visual scans and all that, and they said, yep, we think you have MS. And I'd been in the medical profession for a while, and I'm like, I don't even know what that is. Is that muscular dystrophy, MS? What does that mean? And so it was diagnosed with a relapse and remitting, and that went away with the steroids. And I was kind of strange cat because, so I went to, I read this paper about oral tolerance with oral myelin. So I went to a slaughterhouse, and I convinced them to give me a cow's head. And I proceeded to take the brain out, separate the myelin, the white matter from the. My wife came home and freaked out, but so I put it in pills. I pasteurized it for it didn't work obviously, but I was trying, and so I went from that minimal numbness, double vision, to not being able to get up the stairs, getting the diagnosis. They put me on Avonex. They're like, what do you want? You want Avonex? You want Copaxone? Or you want Rebif? I'm like, I don't know. And so I'm like, well, here, try this one. Well, the first time I took that shot, I felt like somebody hit me with a truck, and so I proceeded to do that, and we were just starting out, and my wife and I, we didn't have children then. It was a lot of money, and so that didn't really seem to do much for me, so all right, well, try Copaxone. I thought, well, that's great, that kind of goes with this oral myelin kind of thing, but the amount of money and the sickness and what I went through for all that period, so there was a video on, it was a French neurologist that spoke exactly what Dr. Wahls was talking about, that these disease-modifying medications, if you look at the Cochrane reports, they don't do what they say they do. So, I literally cried because all the money, all the time, and all the pain. So I continued with that. Went from one cane, limping around the hospital, to 2 canes, to 4 on cane, to eventually the wheelchair. You know, I couldn't practice anymore at that point. Well, they wouldn't give my privileges anymore because, you know, you're not going to take a child to the OR and do work if we don't know what your status is. And so this is kind of how I looked. So we had the 4 children at that time, and I had lost a lot of weight. I was really sick. And I was following all the doctor's orders. So I was on, let's see, I was on, at that point, Copaxone. Well, you're a little depressed here, take the Prozac. Your thyroid's off, take the thyroid. You know, you're spastic, we'll give you some diazepam or you know, I think I was on 9 medications at that point. And so I was towing the line, and I'm not a good patient, but I was doing what they said. And I kept sicker and sicker. And so I had developed a good friendship with a monk, which is really strange, but I did. And so I called him up one day, and I'm like, can you help me prepare to die? Because I thought my breathing was starting to go, my speech was going, I was incontinent. You know, I really felt that way. And, you know, I didn't even have the power to push my wheelchair. I was 135 pounds. So I started to search. I searched pretty hard. I mean, I was willing to cut a cow head open, like, you know. So I found this guy, this Korean healer, and I love Korean. I love Korean food and everything. But he swore that he can destroy, you know, help me walk again by breaking up my fascia. So he would come, and he would massage me every other day. But it wasn't a massage. Those bruises there, he would use, I don't know. I grew up Catholic, so I would like pray the rosary while he did it, because I mean, it was just, I never felt pain like that. And but I figured, well, this is what I got to do. So I put up with it. I began to follow the swank diet. These things didn't work for me. They just continued to decline and getting worse and worse. Then something magical happened. We had a baby girl, our 5th baby. You didn't say it still works. Anyways, see, I thought you said just still something works. But anyways, but so I had this little baby, and I kind of looked up at God, so to speak, and I'm like, really? I'm like ready to, you know, there's a baby now. I got 5. So like, and as like a provider, I don't know. I was just, so I had an aha moment, and a friend of mine who, well, first let's do that. First, I ended up finding my mitochondria, and I delved into that book, and I thought, all right, she's on to something. But that book was a little tougher to understand for me. So when she came out with her newer book, I read the whole book in one day, and I saw, this is what we have to do. This is absolutely, she's really on to something. So I started doing that, and a friend of mine who's a weightlifter, I was just telling Dr. Wahls, he's an MD, he's a dentist, he's a pharmacist, he's a little esoteric, but he, let's slow that down for a second. So he asked me, he goes, well, why aren't you working out? I said, what do you mean working out? I'm like on the couch, I can't even, he's like, he goes, I don't care what you do, even if you have to squeeze and lean forward, you have to flex your muscles. And so my wife and I went on this journey, and she had been she's a physical therapist, treating stroke patients. So I'm doing the Wahls, I'm starting to feel a little better. And so she and I have the idea, let's just train like a stroke patient to recover. So and what was the interesting part about with the baby, I'm speeding up, is I get to watch that baby, how they put their foot down, how they kneed, how they high crawled, how they did certain things. I started to hit the research, and if you look at my right knee there, it was really pointing, and then if you see the progression, all of a sudden I'm gaining strength. But the doctors told me I'm not supposed to gain strength. I went from relapse and remitting to primary progressive, and they said, well, yeah, you're not going to get better, you're just going to slowly decline. But if we look here, you see the strength is improving, and the strength has continued to improve. And so why? Well, yeah, the Wahls protocol, but which was paramount, because I used to try to work out before the Wahls protocol. I would go on the treadmill, the elliptical, and I would physically cry to get through 4 minutes. I couldn't do it. And now I have the protocol, and I'm doing this. And if you're a while, well, you get growth hormone. I mean, the weightlifting community, I was talking to Wahls about this, Dr. Wahls about this, is they have incredible knowledge. They're not doctors, but they have incredible knowledge of what's going on with your body. So to complement Dr. Wahls, everything from growth hormone to testosterone to stem cell activation, satellite cell migration. I mean, they have words that we never heard of. Fatigue management, periodization. I mean, there's so many things. They're like way into it. So I bought into it, and I started 5 days with my wife. 5 days a week. We break it up. You want to have rest days. It's very important that you design the program. And so, again, I have to thank Dr. Wahls, because through this working out, through the diet, what really occurred to me, and I don't want to skip over this, is when I look at Dr. Wahls' protocol, and I study the book, right? That's just kind of the person I am. Her protocol isn't about just the food. It's about, I mean, she was doing East, but I mean, if you're really looking at what she was doing, it was a lot to it. So it isn't just only about what you, but, so I did it. I did it with my wife. This is kind of a crying moment for us, because for 6 years I never touched the water. And when we were younger, you know, we used to really enjoy walks on the beach, going to the ocean and all that. So this happened a couple weeks ago down in Florida, where I actually got to put my feet in the water. I felt strong. Like, I literally could walk a little now. I won't now because I don't want to fall. I got a concussion last year. But, so, you know, my whole body's changed. I gained 35 pounds of, I can think it's muscle. I don't know. And my body's changed. I feel better. I don't have speech problems. I talked to my neurologist last year. I'm like, when I used to come in, was I slurring my words? He's like, yeah. I said, am I slurring them now? He's like, no. What about Dr. Wahls? What? I'm like, all right, well, I think that's pretty good. So anyways, thank you, Dr. Wahls. And you changed my life, and you're changing the world one patient at a time. So thank you.